I'm Matt Willis, Public Health Officer with a COVID-19 update for October 15th. Last week, we released the criteria we're using to eventually lift the local mask mandate. I'd like to explain this and highlight what this means for our pandemic progress. Here are the criteria and where we stand in Marin. Basically, we want to see three things to ensure the conditions are right to peel back the mandate: fewer cases, fewer hospitalizations, and high vaccination rates. We'll start with cases. We need to see at least 3 consecutive weeks in CDC's moderate or yellow tier for community case rates. For Marin, this corresponds to an average of fewer than 18 cases per day. For us, that clock started on Tuesday the 12th, and we're the only California county in that yellow tier currently. It's too early to say if we'll stay in the yellow tier for 3 weeks, which would bring us to November 2nd, since it's only been 3 days. And when we're this close to the margin, even small changes in new cases can change our tier. We know the best way to keep that progress is for more of our eligible residents to be vaccinated, including those over age 65, to get booster doses. That's a different discussion, but importantly, we're seeing more cases among older residents who were fully vaccinated more than 6 months ago, and only 1/3 of those eligible in this age group have received their booster. Getting a booster dose if you're over age 65 is important, especially as we come into the holidays. The second criteria for lifting the mask mandate is low and stable COVID-19 hospitalizations. We want to see fewer people hospitalized with COVID-19 before lifting the mandate. This is related to the first criteria because as case counts drop, we generally see a corresponding drop in hospitalizations and deaths. Last week, there were 15 people hospitalized with COVID-19 in Marin, so we set that as the metric. We want to see fewer than 15 people in our hospitals for COVID-19 before lifting the mandate. This approach, keying off the hospital numbers last week and looking for fewer over time to signify progress, is being taken by other counties as well. Achieving this metric is another argument for our older residents to get boosters. Among the 22 people in Marin that have been hospitalized for COVID after being fully vaccinated, 3/4 are over age 65. So that immune boost can help keep you out of the hospital. The last and third criteria for lifting our mandate in Marin is achieving 80% vaccination rates across the whole population, all age groups. Fortunately, we achieved that benchmark on Friday of last week. So it's not a coincidence that the community with the highest vaccination rates also has the lowest case rates and is the first into the yellow tier in the state. Stepping back, immunity through vaccination is the single most important reason the virus is less active in our community. It's difficult to describe the number of ways our vaccination rates are protecting us, but we get a glimpse when we look at the inverse experience, places with much lower vaccination rates, where we see overflowing hospitals and morgues, ongoing outbreaks in nursing homes and businesses, and school closures. Vaccines are the main reason we're able to consider peeling back restrictions, from easing restrictions in select spaces where small groups are fully vaccinated to eventually lifting the county-wide indoor mask restriction. And vaccines will continue to protect us against potential future surges. I hope this is clear as our children aged 5 to 11 become eligible for the protection of vaccines next month, and as we urge boosters for our most vulnerable older residents. We've been talking about the local mandate, but where it comes to laws requiring mask use, remember that there are more state mask mandates than there are local ones. The state mandate still requires face covering of unvaccinated people in all indoor public settings. In schools, the state requires everyone to cover their faces indoors, regardless of vaccination status. And California regulations also require unvaccinated people to cover their faces indoors in the workplace. The simple reason for these regulations is face covering reduces risk of transmission. Remember, before the local mandate was added in August, most Marin residents opted for masks indoors anyway. We especially recommend anyone with risk for more severe outcomes to continue to wear face covering after any mandate may be lifted, as well as anyone who simply feels more secure or safe with face covering. Face covering will remain common and important over the coming months. Hopefully, this offers a glimpse into how we'll approach peeling back specific laws that were imposed when conditions required it, and how we'll shift from legal obligations to simple recommendations. As always, we'll monitor conditions closely and post our data publicly to ensure we can take the next step safely. We've weathered this pandemic as a community, and we'll keep tiptoeing back towards normalcy together. Thank you for doing your part.